on the NewsChannel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Glad you are with us tonight. It is Tuesday, April 21st, and we're talking about what everyone is talking about. Should Tennessee reopen for business? Now, of course, Governor Bill Lee is ending his Safer at Home order. That expires on April 30th. That means May 1st, 1 week from Friday, most businesses in 89 counties will be allowed to reopen. However, that does not apply to like Nashville and some of the counties that have larger cities. We wonder, what do you think? We want to hear from you. We are going to be talking with Representative Bruce Griffey. He's a Republican out of Paris, Tennessee. Over the weekend, he wrote a letter to Governor Bill Lee. Here it is. He wrote it on Sunday, April 19th, and he asked the governor to immediately open up the state. So he certainly has an opinion. He wants the governor to immediately open up the state. And so we're going to talk to him about his letter. Again, want to hear from you, but let's now go via Zoom to Representative Bruce Griffey out in Paris. Representative, thank you for being with us.
Thank you, Ben. Pleasure to be here.
From your home there in Paris, we appreciate it. All right, so why did you write this letter? Essentially, what does the letter say? Why did you write it?
Essentially, Ben, we're seeing devastating economic impact on our economy throughout the state of Tennessee as well as the country. When the state decided we needed to take measures to shut down the economy, the premise of that was we don't want to overwhelm our healthcare system. We only have a limited number of hospital beds. We only have a limited number of ventilators. And the way this virus was developing, it was a considerable and legitimate concern that we may very well totally overwhelm our healthcare system and not be able to provide ventilators and hospital beds for folks that do get infected. Fortunately, and I think to Governor Lee's credit and the credit of President Trump and all the officials that have been working and advising the administration, certain areas have not seen the overwhelming numbers that we were concerned about. Given that, there are definitely detrimental impacts of shutting down the economy. People cannot earn a living. They can't pay their bills. They can't go out and buy groceries unless they get assistance. We tried to set up some assistance programs for folks that are in that situation. They've been working, but not as well as we'd like for them to have worked. I still have a number of constituents that have applied for unemployment benefits, still have not been able to get them just yet. Most of them are independent business owners and so forth. So since we're not overwhelming our healthcare system based upon the numbers we're seeing, at least in the rural areas in my district, and I think some of the other districts, and some of the more least populated states in the United States, I submit it's appropriate to go ahead and open up economies, continue to practice social distancing, safe hygiene methods, washing your hands, coughing into your elbow. But I think we can open up businesses rather than shutting everything down and damaging the economy, perhaps irreparably. We're not sure what that outcome would be.
So in your letter, you asked the governor to open up immediately. Don't even wait until May. Open up immediately. So what do you think about his announcement that he is going to wait till May? What do you think about his announcement?
The governor has done a fabulous job. He's got more facts and data than I have. I ran my poll on a Facebook. It's non-scientific, but I was really astounded that we got over 8,700 people responding to that poll. Indicated at first most people wanted to remain shut down, stay-at-home orders. But as the days went on, I think it was a 4 or 5 day poll. As the days went on, the sentiment shifted, the consensus shifted, and about 55% wanted the state to go ahead and open up. I wanted to share that with Governor Lee. I mean, he's doing a great job. He's got the experts, but I wanted to share that with him. And when I went to Lowe's and Home Depot myself over the weekend, the parking lots were packed. They were full. There's hundreds, if not thousands, of people going in and out of these businesses. And they do provide essential services. You need food and groceries to survive. But the problem is you've got somebody had to say, well, this business is non-essential, so I'm going to make them shut down where they can't earn a living, but I'm going to allow, Lowe's, Walmart, Home Depot to continue to operate. I have a constitutional problem with that, but the point is, if those businesses are continuing to operate with hundreds of thousands of people going in and out of the businesses, interacting with the store clerks and so forth, and we haven't seen the explosion in COVID-19 cases in our area, I don't think we have the justification that we have to continue with a complete shutdown of the Tennessee economy.
Now,
I think we can be safe and prudent.
There's some healthcare professionals that are concerned. We are going to be opening too soon. That we've certainly done some good work here. We're flattening the curve. But there was a Vanderbilt report last week that showed the virus is still spreading faster in the southern middle Tennessee area than any other part of the state. It hasn't hit rural areas as hard yet. It's certainly hit more urban areas harder. But what do you say to people that say by just opening everything up, we put people's lives in danger and we reverse the progress that we've made with the sacrifice of social distancing that we've done to this point?
Well, you've got to balance the damage that you're doing to the economy versus the risk that we're facing. And for my district, in Henry County, we only have 2 active hospitalizations out of the entire county. One of those individuals is on a ventilator. One of them is not. The remaining cases, I believe we got 4 or 5 in Henry County. They're sheltering at home and taking care. The indications are that it's a certain select number, small percentage of individuals that have a very hyperactive of their immune system response to the COVID-19 virus, and they're the ones that get into trouble. But again, that is generally a small percentage of the population, and generally folks that have a weakened immune system and the folks that are over 65 years of age. I think it makes more sense to let's try to protect those individuals in that group and have them continue to stay at home, but let's let the rest of society function. My dad's 86 years old. He's a physician. My brother's a physician. I've consulted with one of my friends who's a vascular surgeon, and I asked him about this based upon the numbers we're seeing, and they both shared with me that they felt like we could probably open up and continue to practice safe hygiene practices, social distancing, masks, whatever's necessary. And if we have a hot pocket, get aggressive and address that and try to shut it down. But we're simply creating so many individuals who are hurting that are not seeing the numbers that we thought we might see. So it doesn't really make sense to continue with the complete shutdown of the entire economy.
So in your letter, you said you urged the governor to open up immediately. Are there some limitations to how far we should go? Are there some things that should remain closed, or are you saying just completely open up?
Well, I'm not, again, I don't have the expertise and the consultants that the governor has at his disposal. When I went out to Lowe's and Walmart and the parking lots are full and I saw hundreds of people going in and out of the stores, it doesn't make sense for just to keep a flower shop closed if they've only got maybe 10, 20 people a day, or somebody else, a bakery or somebody that's got a store that they can practice social distancing, have their customers separated. I just don't see the benefit of preventing those from earning a living if we've got Walmart and Lowe's doing the exact same thing, and they're making money, but we're telling these folks, you can't make money, you can't earn a living. It's extremely problematic for me.
Does it make sense for you, in your opinion, and we'll start taking calls here in a moment, that larger urban areas should stay closed? Or do you feel like just open up the whole economy? Because when a city like Nashville is closed, it definitely hurts the economy of the state. But what do you think about some of the larger cities not immediately opening up?
Ben, I think when you have certain areas like Nashville and Sumner County, the virus got into their nursing home population and just created devastating damage. We've lost a lot of lives there. That's where the majority of the loss of lives that we've seen, and that's heart-wrenching and heartbreaking. So in those areas, definitely, maybe they should stay at home. We don't need people as communicating and going out as much as in public. Maybe they definitely need to require everybody, please wear a mask. But in rural counties, we have very little outbreak of this. We're shutting down entire counties, and nothing happening economically other than the Lowe's and the Walmart or the grocery stores, and everybody else is suffering. It seems like we can do both. It's not an either or. You can do both, and you can be smart in how you open up and where you open up. And if we have problems of additional COVID-19 cases that explode or flare up, we can get aggressive in those areas and try to address and deal with those. I think the government's doing a great job. Bill Lee's doing a great job. We got to be smart about it, but I don't think it justifies shutting down the entire economy any longer.
Democrats held a news conference today, and they said that the state is unprepared for this move. They said this is a political move before we have all the systems in place that we need in place. We do not have broad-based, easily accessible, free testing. We do not have contact tracing, and the illness simply is not fully under control. So several Democrats said that today in their news conference. What do you say to that?
Well, my response would be, if you'll go to the Walmart in Paris, Tennessee, or the Lowe's in Paris, Tennessee, and you'll see the filled parking lots and people filing in and out. And we've still got a limited number of cases in the county. 4, I believe, 2 in the hospital, 1 on ventilator, 1 not. To shut down an entire county and the entire economy for folks, I just don't see the justification. It would be great to have all the contact tracing and so forth, and I would advocate that we try to do that, but I don't think we need to shut down everything and wring our hands and, oh dear, there's no way we can open up the economy. We've got to have these measures in place before we can do that. I disagree with that assessment, respectfully. They're entitled to their opinion, but I just want to share with the governor my assessment of what's going on in my district and urge him to go ahead and open up.
The low number of cases in your district and in that county, do you think that's because of a lack of availability of testing?
No. We've got testing in all 3 of our counties. You can drive up, put it on by the health department. You can drive up, get your test, and we're loosening the restrictions. No longer required that you have to be symptomatic or whatever. You simply go in and get it. The turnaround time, as I'm hearing, is 24, 48, 72 hours on the test results. So I don't think the lack of testing is it. I think we're just being very fortunate. There have been recent reports from a number of studies that perhaps the entire U.S. population has had a larger exposure to the COVID-19 virus, and that just the number of folks that have an adverse outcome is much lower than what was originally estimated. The estimates used by the federal government and some of the healthcare models have been wildly off. They were predicting millions of deaths originally. That has been totally pared down. So, look, I'm not trying to lay blame or be critical of that. The point is, this is a novel and new virus that we've had to deal with. We're learning things every day, but it seems like currently, if we were worried about overwhelming our healthcare system, we are not seeing that. Based upon that alone, I think it's appropriate for us to go ahead and open up the economy in the districts where we don't have a large flare-up. So we can go ahead and open up, and if we run into a flare-up, we can be more aggressive.
There are some healthcare professionals who say the reason that we haven't seen the big spike that was projected at one point of up to 2 million deaths is because of the work we've done, because there has been a lot of self-isolation, people have been staying home, and that, again, if you take your foot off the gas, then everything could spike back up. What I'm hearing you say is that you're seeing people there in Paris that are going to Walmart and that are going to Lowe's, and it doesn't sound like there's a great deal of social distancing going on. I mean, is that a fair characterization, or what would you say?
It's you hate to just generalize too much, but I went by Lowe's for something today. Probably about 30% of the individuals had masks on. Customers had masks. I believe the Lowe's staff generally had masks if they needed. If they got close to someone, they would put their mask, raise their mask up. I don't think that this virus, from current data, now things could change and the landscape could change overnight. Who knows? But I don't think we're seeing the alarming numbers of adverse consequences in the percentage of populations that were initially predicted by the models. Models seem to be just completely over-exaggerated what we were expected to see. And that's not just the United States. That's for a number of the countries. Ixox, Ben Israel, a doctor out of Israel, did some modeling and so forth. It says his models indicate that really regardless of what you do, you're going to see a certain level in reaction by the virus within the population, regardless of whether you go the Sweden model and have no social distancing or preventative measures, and those that have really tight restrictive preventative measures. So this is a new virus, and it's a new situation for everyone to try to address. And so you kind of got to take the bits of information you get as you go along. And from what we initially were told was that this is going to be so bad, we're likely to completely overwhelm our healthcare system. We're not seeing that. In fact, we're maybe at 30% of our healthcare capacity. In a number of healthcare facilities, they're actually having to lay off our nursing and healthcare staff because they don't have the other numbers to treat regular patients that come in for elective surgeries and other measures like that. So that's, to me, is really problematic if we're so worried about a health condition that we're actually having to lay healthcare workers off. Something's not fitting there. Something's not jiving or gelling.
Okay, all right, we're going to start taking calls here, but I guess my last question, how concerned are you that by relaxing these strict standards that we have been doing, and standards that appear to be working, it could be that the virus isn't as potent as we thought, or it could be that these things are working, or maybe it's some combination. But how concerned are you that we do what you're asking here and open everything up, and then we just have another flare-up, and we do see this come back and cause the problems that we were told that it might cause? How concerned are you, and how likely do you think that will happen?
Well, it's just a wild guess on my part, but look, we have been in this shutdown mode for 3 weeks now. The non-essential businesses have been shut down for a number of weeks. The essential businesses, Walmart, Lowe's, and the grocery stores have continued to operate. And throughout my district, people are still going in and out, and we're not seeing an explosion of numbers. And so if the predictions and the models were that if you don't do all these things, we're going to have explosion of numbers, well, we've got Walmart and Lowe's and the grocery stores. People are going in and out, having interactions. We're not seeing explosion numbers. So to me, something is not adding up, if that makes sense. So I'm certainly not willing to jeopardize an entire economy based upon models that are not seen to be working out. And we're not seeing the damage that we anticipated. So I think a more prudent approach is let's open up where we can, see how that goes. If we run into flare-ups, we can address it. But to continue with a complete shutdown, I think makes little sense at this point.
All right, that kind of sets the table for the discussion. We now want to hear from you. So we encourage you to call in with your comments, your thoughts, whatever you want to say. There's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.